Many people with neck, upper back, or shoulder issues have very tight upper trapezius muscles and levator scapula muscles, and often results in a kind of muscle that gets knotted up and really tight and really sensitive just above the shoulder blade. So part of the rehab for many of those conditions is stretching these muscles to get them to relax a little bit, so that way the strengthening exercises we use can be more effective essentially. So I'm going to show you how we can stretch the upper trapezius and levator scapula muscles that often get tight and uncomfortable with many neck pain, shoulder issues, mid-back issues, things like that. So to stretch your upper trapezius, what you're going to do is you're going to take your ear to your shoulder. We want a nice gentle stretch over here. We're going to take our hand, add just a little bit more pressure. And when we're holding these stretches, we want it to be a gentle stretch, very slight discomfort. We don't want to push into any pain or any discomfort. And we can hold that stretch anywhere from 15 to 60 seconds. And we can do that both directions. Again, just using our hand to add a little bit more stretch, a little bit more pressure to the stretch. And we should feel a stretch all the way along that opposite side. To stretch the levator scapula muscle, what we're going to do is we're going to look down towards our hip pocket. And from there, we'll take our hand and we can pull into a little bit more of a stretch. So with this one, we can kind of change the angle a little bit. So we can pull a little bit more forward or a little bit more to the side, depending on where you feel the tension, and kind of stretch that area that you find the most tension. And again, we can hold that for 15 to 60 seconds and do it on each side. This is not going to be the only way to solve that issue of that tight muscle in the area, but it can help us relax. That way when we do the strengthening exercises of the lower traps and some of the stabilizing muscles of the scapula and posterior shoulder, they'll be more effective essentially. Give that a try. Let me know how it does.